One. Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight we have a continuing series in the series of hangouts on Parkinsonism by Dr. Abdul Rana, a neurologist from Toronto and a world-renowned Parkinsonism medical educator. Tonight he's going to talk about speech problems in Parkinsonism or Parkinson's. Dr. Rana says patients call it. So good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you doing today?
Very good. So you dug out from the snow.
Yes, it's getting better.
Yeah, the temperatures plunged in Miami to 50 degrees. I had to put a long sleeve shirt on.
No, we still have in minus, but it's better than before.
Very good. Okay, Doctor, how are speech problems related to Parkinson's?
Speech problems are a very important non-motor symptom of Parkinson's disease. Speech is the main means of communication, and it does affect these patients. So about 80 to 90% of the patients get some speech problems at some time in the course of the disease. They are told to repeat themselves. They have a difficulty with the conversations, and they also start realizing with time that their speech is becoming less comprehensible. They have difficulty during meetings or attending any of the daily activities, such as going to bank or seeing a store clerk for groceries, because they are repeatedly asked, excuse me, can you say it again? Can you repeat what you said? So that makes them feel embarrassed. And sometimes this could lead to social embarrassment and social isolation. These patients could get depressed, or they may be socially withdrawn, and they start engaging them less in family events or in dinners or in family gatherings. So the exact mechanism of these problems is not clear, but these patients usually get many different types of problems. They lose that variability in the tone. Like a normal person would speak according to the situation. Sometimes their tone is loud, at other time they would lower their tone. But these patients lose that capability of increasing their tone or lowering their tone according to the situation. So their speech is a monotonous type of speech. They lose that pitch variability also. Their articulation becomes imprecise, and some patients start having short runs of speech, like they would speak fast and then they would stop, they would stutter, or sometimes at the start of the speech they would hesitate. They would have this start hesitation of speech. They would stutter on some words, and their speech becomes breathy, and sometimes it could be confused with the sore throat. It could be mistaken that these patients have a sore throat, so they could attend a walk-in clinic or see a GP, and they are treated for pharyngitis or throat infections, and these type of confusions occur quite often, especially if the patients are not aware of speech problems related to Parkinson's disease. So they may not know that this is part of Parkinson's, or when this is beginning, so they are not aware that their Parkinson is affecting their speech. So I had a patient who had a sore throat type of voice, and he was treated with antibiotics, and his GP could not find out what happened. The sore throat was there for a few weeks, and his throat swab was negative, and then he was sent to ENT. So ENT gave him another course of antibiotics. He did not get better. When he came for a follow-up visit for his regular checkup for Parkinson's, so we realized that his speech was soft, and he lost that tone, and it was a kind of breathy. When we had a discussion about this, then he told us that he had been through so many courses of antibiotics. So educating these patients about speech problems and voice disorders is very common, is very important, and it does help them to undergo various types of treatment, which may be in some cases unnecessary, or any type of interventions. So these problems are not uncommon in this patient population, and especially most of these patients are elderly, so they may think that their speech is being affected as part of their age. So this becomes quite of a problem in patients with Parkinson's disease, and especially as their Parkinson's disease advances, these problems start happening more often, and they get worse. Therefore, early assessment of these patients is very important.
Doctor, how do you manage speech problems in Parkinsonism patients?
Most of the speech problems don't respond to dopaminergic medications or any other type of medications. So we end up advising patients to have speech therapy as early as possible, because early assessment and interventions do help to maintain their speech, and also to them they would learn those strategies which can help in their day-to-day communication. So a referral to a speech therapist as early as possible is quite helpful. These speech therapists, they usually do multiple types of speech therapies. The traditional speech therapy is one of the method, and then there are several other techniques which are helpful in spite of voice problems affecting so many patients. Indeed, there are very few number of patients who are seen by speech therapists. This could be because patients are not aware. Even in healthcare workers, there is not much education that these speech problems can be helped to some extent. And on the other side, the traditional speech therapy has a very limited success rate. So these patients also, one of the factors is that these patients, they don't feel themselves that their voice is low. They hear themselves loud enough, and so they may not make a conscious effort to increase the volume of their voice. And also, because most of the patients are elderly, they may have difficulty acquiring new skills or learn a new knowledge, and those techniques which help these problems. And also, when these patients are undergoing treatment for speech therapy, their success could be seen sometime in the treatment room or for a few weeks, but to maintain that success rate for a longer period is quite difficult. The Lee Silverman voice training program is a quite well-established treatment program for these patients. It focuses on increasing the volume of the voice and also increasing the ability of patients to perceive more effort and getting a high involvement from patients and treating intensively. These patients usually have a course of 4 days a week, and usually runs for 4 weeks, and then these patients are assessed by the speech therapist as the course of therapy is going on. These patients are given assignments to do at home, and the target is to increase their voice volume, effort, as well as more coordination. These patients are encouraged to improve their breathing, because breathing has a great role in speech. Also, they are emphasized to improve their articulation and lessen the stiffness of the muscles of their mouth and throat, so that their speech can improve. The sensory training is also an important part of this program, because these patients now, when they make a conscious effort to increase the volume of their voice, so with this they hear themselves loud. So now they have to be ready, or they have to be trained to hear themselves loud and be comfortable with it. And another part of this is that these program of the LSVT, which gives them this this improvement over a short period of time, how to maintain this that improvement. So those exercises which they do in the classroom, they should try to do it after the program is over. So that's an important part of this. And in addition to the LSVT, there is a program, pitch limiting voice training, which is like in addition to LSVT, and it focuses on maintaining the appropriate pitch of speech. These patients are trained to speak in a low voice, but they should so that they can prevent the strain or the harshness or the pressure in their voice. This is in addition to LSVT, and it does help. Sometimes these patients are treated one by one by speech therapist. When they're being treated one by one, so the speech therapist can give them a feedback about their success, and at other times, due to limited resources or limited number of speech therapists, sometimes speech therapists could do a group therapy. So the whole group of patients meet, and the speech therapist reviews with each one their problem, and then goes through techniques and training. And in group therapy, the patients assess each other, and they provide feedback to each other. They ask questions, and they give speeches to the whole group. They engage in argument, and this does give them more confidence. And they ask questions to each other. The only drawback of the group speech therapy is that the speech therapist is not able to evaluate each patient one by one.
So the general strategy is to identify the speech problem and bring it to the attention of the patient and send the patient to a speech therapist.
Right. Sooner the treating physician is able to recognize their speech problem and send a referral to a speech therapist, and they're seen, I think this does help to keep their morale. Otherwise, their speech becomes voice, and I have seen patients who were barely able to communicate. They just, you can't just hear them if they don't get a treatment. Their voice would be so soft that it becomes non-comprehensible.
Is it a subjective determination of the doctor whether a patient has a speech problem, or is that some kind of medical device that the patient speaks into, or something of that nature, like a microphone or something?
Yeah, I think it's like a slim approach. The patient, they have some idea about their speech because they are now being told that they have to repeat, or they sometimes realize that their speech is becoming more affected. Then family members or caregivers do realize that the speech is not as it was before, and also physician, because usually physicians see these patients every 3 to 4 months in the regular Parkinson's clinic. So if they remember their patients well, so they can feel that their voice is not as it was before. So the whole team, and then you always ask them, is this affecting their activities of daily life? Is this causing them any social embarrassment? Or is this affecting their activities of daily living? So if it comes to that point, I think at that point they should be referred to a speech therapist. As far as the device, I don't think there's any any kind of device which they can use to diagnose. So it's a both subjective as well as objective assessment when you see patients in the clinic.
Okay, I guess every patient, of course, is different in Parkinsonism, but generally speaking, speech problems occur at the beginning of the course of Parkinsonism, and midpoint, late in Parkinsonism. Is there a typical scenario for a Parkinson patient as far as speech problems?
Yeah, with respect to various types of Parkinsonism, in atypical Parkinsonism, such as progressive supranuclear palsy, patients may have speech problems in the beginning of the course of disease. Their speech may become stiff in the beginning, and sometimes this is how family realizes that their speech is not sane. But in idiopathic Parkinson's disease, the 80% of the primary Parkinsonism, these patients usually don't have any problem, any major issues in the beginning. In the beginning, their speech is fine, but within a few years into the disease, they start getting the softness of voice, or short runs of speech, or they start losing the tone of their speech. Usually in idiopathic Parkinson's disease, the speech problems don't happen in the beginning of the course of the disease.
Is there any noted improvement in speech problems when patients have deep brain implants? Is there any connection at all, or you don't notice any?
Indeed, with deep brain stimulation, the deep brain stimulation mostly is targeted to improve the motor symptoms of Parkinson's disease.
Okay.
Some of the non-motor symptoms may improve, but speech problems usually don't improve, or in some cases, they may indeed get worse. Dysarthria or speech problems could be a side effect of deep brain stimulation.
Oh, okay. That's interesting.
Right. The midline symptoms, we call them midline symptoms, the speech problem, swallowing problem, or issue with balance. These symptoms usually do not improve with deep brain stimulation. Those symptoms which improve with levodopa, they do improve with deep brain stimulation, but not much success is guaranteed with respect to speech and other midline symptoms.
Okay. Well, very good, doctor. Thank you for tonight's video on speech disorders and Parkinsonism. And
I had to add some general strategies.
Okay.
We advise patients for day-to-day speech issues because breathing has a coordination with speech, a lot to do with speech. So we tell patients to be aware of their breathing, and before they start speaking, they should breathe in and then start speaking so that they don't run out of the air when they are speaking, and they should keep their speech slow as well as even. Like they should not speak fast in the beginning and then they get out of breath and they can't continue. So keeping the speech slow and even and breathing in before they start to speak, it helps. And also forcing their lips or jaw to work hard as they pronounce certain words is helpful. Making an eye contact with the speaker if they are in front of a listener, so they should try to make an eye contact, keep an eye contact, and also before starting or engaging in a conversation, they should establish a topic, and they should also try to finish the sound of each word before they would start speaking a next sentence. And also asking the family members and friends about the input is very helpful, because family and friends are seeing these patients more often as compared to physicians. So asking them the feedback of their speech really helps, and it gives them a constant way to improve. And if they are engaging in a conversation and there's a background noise going on, such as TV or radio, trying to lower this background noise. In addition, if some people are quite helpful, they try to speak on behalf of patients. So you should decide. A patient should decide when they would like someone to speak on their behalf. Usually speaking for themselves is more helpful. It keeps the confidence of the patients, keeps their voice, and it gives them encouragement. So they should not try let other people to take over and start speaking for them if they feel that they can carry on. But at the time when they don't feel that they can carry on, at that point they can ask someone to speak, keeping their head straight when they're speaking, and if they're speaking in a phone, so keeping a mouthpiece directly in front of mouth is quite helpful. And sometimes you can try to warm up before starting to engage in conversation would helpful, and keeping the mouth off of saliva is good. Also deep breathing and relaxation exercises, deep breathing, holding, and then letting it go. It helps. It entrains a person to how to engage in conversation for longer periods. And speaking in short sentences is quite helpful. Instead of speaking long sentence, so break your speech in a short sentence, like speak and then take a break, take a pause, and then speech again. and also giving group speeches. That is one of the benefits of the group speech therapy, that you can talk to more people. So giving group speeches is always helpful. It keeps the person active, and they should try to exaggerate their loudness of the voice when they're speaking. So the patients are told to be loud, so they should try to exaggerate the amount of loudness than required. And also they should try to take more pauses and more breaks, and try to face the speaker and give them full attention. And also at the same time, they should try to relax, because if a person is more stressed, their speech would get worse. This will make them anxious. It would be like a vicious cycle. The anxiety will affect the speech. So anxiety will affect the speech, and not being able to speak good will cause them anxious. So it will make things worse. And if these patients they don't have any success with speech therapy and all these techniques, they could use like voice amplifiers, which are very helpful. Sometimes using a notebook and writing alphabeticals would also be helpful. Using whiteboards is good. And sometimes those people who speak very fast, they could use the pacing boards. The pacing boards will help to make their speech even when they're speaking. And there's a device on which you can type and it will speak for you. Like you can say a word, eat or drink, you type and it would speak for you. And that type of voice devices, you can rent it even from some clinics for a short period and use it.
You know, Doctor, one observation I'd like to make, and you mentioned this in a few of your talks, is that that the family is involved in treatment of Parkinsonism. Now, I don't know if it's typical of other neurological things too, but it seems that the family really does have to get involved with many aspects of taking care of a Parkinsonism patient.
Right. Parkinson's is a very complex condition. It causes so many issues and affects so many systems that a person may not be able to recall all of the symptoms when they're seeing a physician after a few months for half an hour, 45 minutes, or an hour. So the role of caregiver is very important. Sometimes you can write things, how the patient is progressing, or if they are having any side effects or problem. And then when you come with the patient, you can ask the physician, and you can keep the lines of communication with all members of the team: physiotherapist, speech therapist, physician, or a Parkinson's nurse open. So the role of the family member or a caregiver is very important, because patients sometimes they have cognitive issues, and they can't discuss those things which they face at home. They don't remember and writing, especially if they're right-handed and their Parkinson's starts on the right side, so it causes significant problem in writing, and sometimes they would forget to bring those questions with them. So it's very important that the caregiver or the family member involves with the patient in the team which is treating the patient.
Very good, Doctor. Thank you again for another great presentation on speech problems and Parkinsonism. And we'll continue tomorrow night with another presentation. Thank you, Doctor.
You are welcome, Dr. Bennett. Thank you.
Good night.